So, hello, TV. Thank you so much for again on my podcast. Uh, this time we will discuss like many family choose a large assisted living facility, believing that it is the safest option, but then something changes. Let's talk about that moment. Why does a parent who was doing fine just a few months ago suddenly seems worse or neglected in a large assisted living facilities, even though nothing obvious has changed?
Well, one of the causes could be the natural causes, which is called aging. And um, by far, most of the population in an assisted living, it is an elder population, and people are aging in place. Many of those individuals, they have a one or two or three or more diagnoses that in time can impact their cognitive or physical condition. So people aging in place, their needs change, their level of care changes, and what 6 months ago it seemed to be an ideal situation, ideal environment, and everything was going great. All of a sudden, um, health issues are happening, and that changes everything. So assisted living, it is the assisted living setting in itself, it is a really good environment uh, for elderly, and especially those that they still have a pretty high level of independence, so they can fully benefit of all the activities and the lifestyle and the things that an assisted living offers.
So,
Yeah.
is this usually one clear incident that wakes family up, or a slow accumulation of small things that just don't feel right anymore? Like if if like they need a more care. What's your opinion regarding that?
So it could be a variety of reasons that would trigger somebody's condition or overall well-being. And that could be a UTI, it could be a rapid decline in their cognitive condition, and all of a sudden, the daughter or the son or a family member or even other residents or staffing at that assisted living, they realize that um, uh, Carol, for example, the resident Carol, all of a sudden she started to have significant memory issues, or she can become verbally aggressive, or all of a sudden she does not remember how to return to her room from the dining room. Um, so that is definitely a red flag, and that has to be explored and see what is the reason that all those symptoms are showing now. And again, it could be a medical condition, or it could be a natural decline of someone's cognitive condition. Another rapid example of a rapid change, it could be that someone has a fall and they injure their head, they can break a rib, they can have a broken hip, or something like that significant happens. So the person goes to the hospital, and the resident Carol, for example, who previously was very independent and walking, it was ambulatory without using any devices. Uh, all of a sudden, now she's in the hospital. She had a hip surgery, and that changed everything. And from totally independent, now the resident requires one or two people assistance, meaning that one or two caregivers uh, are needed in order to help her with the daily activities, which would be getting out of bed, dressing, showers, escort to the dining room, to the activities area, just examples of that kind. Yeah.
So, like,
In other cases, people, they need their medication to be adjusted, and somebody is taking some meds for a long time, but their condition changes or they're aging. So sometime it gets to the point where the medication needs to be adjusted. So it always comes down to a teamwork, and part of that team are the residents themselves, their family members, the staffing at the assisted living, and their doctors. So good communication between all those team members by far in most cases results in a good outcome.
okay, that's good to know. But is it normal for families to feel like their parents had gone from being a person to feeling like just a number in these 100 plus room facilities? Because sometimes, like, because they are like these facilities treating every member like same way, but sometimes, like as you say, like something happen and they need more attention or more care, but it seems like they are generic or they are just a number in a room.
So if the question is about the family members, it all depends. And when I say that is everybody's different, everybody has a different perception of things, and everybody has a different way on accepting or not accepting the reality. And I've worked with family members in the past where, even though mom had a clear diagnosis of dementia or Alzheimer's, you know, the daughter was still, or she still seemed to be surprised, when she was noticing that mom has memory issues, or she couldn't remember what she had for breakfast, or was asking the same question, 3 times in 5 minutes or 10 minutes. And the daughter is like, wow, how is that happening? Because mom never did that before. But mom was diagnosed with dementia or Alzheimer's 2 or 3 years ago, and things have progressed, and more symptomatic issues are coming up. But some families, they have a harder time to accept the reality versus others.
You are exactly like answer my questions that like almost my next question is like most of the time like families feel or often like realize like the stuff is nice but my parents still seem to worse. And when you hear that, what's usually happening behind the scene? And like as you say, like sometime like uh family member diagnosed like the memory issues or any other issue. So like what actually happened when a facility tells a family we can't handle your parents here anymore, and how should family understand that moment, because that is like kind of the heartbreaking moment because they are not ready for that, they don't have any idea, they are not aware about that situation.
Yeah, definitely that is a, significant moment in everyone's life that it's involved in that. Um, Usually there is a progression of things that ultimately leads to a facility, an assisted living, to tell the families that their parent living there is not appropriate any longer. There is quite a bit of things happening prior to that particular moment. And the normal progression of things would be, let's say, the staff notices that this resident is starting to have more memory issues, or she's starting to be more having physical issues, meaning that she's having more and more poor balance. Uh, she had a fall a couple days ago. Luckily, nothing major happened. She didn't break anything. And then walking to the dining room from her room, the staff notices that the resident is wobbling a little bit, or she just doesn't have the same balance as she used to. So at that time, normal progression of things would be to have a conversation with the resident, to notify the family members, to have a meeting with the resident and the family members so the staff can address those issues. Now, for someone being some ambulatory issues, that's not a reason to ask someone to move out of a facility. But one technicality that a lot of people don't know is that all assisted livings, they're called assisted livings, but each one of them is licensed differently. And depending on the licensing they have, they can or cannot provide certain services. So if a resident, either due to aging in place or change in their cognitive or physical condition, they get to a level of care or a level of services that they need where the facility doesn't have the proper licensing for it, then that would be a moment when the facility would ask the family and the resident to come and have a conference. Usually it's called a care conference, where they can discuss those issues. And if the conclusion of that meeting is that the facility is just not able to provide the services that the resident currently needs, then there are two options. One would be to hire a private caregiver that the resident has to pay on top of what they already pay the facility, or the resident to move to another facility that has the proper licensing and the proper staffing to accommodate their needs.
So
And
like,
hopefully now and in the future, so they don't have to move again.
yeah,
That's why that's why families and the residents themselves, whomever is part of the process of choosing an assisted living, they have to know what questions to ask, and they have to really find out what that facility is able to provide as a level of care, or what they're not able to provide. Because sooner or later, the resident living in that facility would get to a point where the question will come up if the facility can accommodate their their needs or not any longer. And it a lot has to do with the type of licensing that the assisted living facility has.
yeah, need more attention, more care. The family members need more attention and care. They have a care meeting, and at that time period, there are some emotional trauma most of the time, like families going through. Sometimes they feel like after like these kind of conversation conference they're going through, uh, and hearing those kind of situations, sometimes they feel guilt, sometimes it feels like fear, panic, and exhaustion. So how to manage those emotions? Because most of the time, like when people go through these conversation, it is very overwhelming, and they don't know what to do and how to handle those emotions, because sometimes they blame themselves, like they are not able to care or they didn't choose the right facility. So what advice or what you wanted to tell those people, like first thing, like who, like what's the first step they have to be think about it?
Well, that is a little bit of a difficult question, and that's because everybody is different. And there is always, when it's a change in a parent's condition, there is always an emotional factor. Just the fact of a mom or a dad moving out of their home that they've been living in for 50 years, maybe. Now they have to move out and they move into a senior living place. So just just the beginning of all that process, the thoughts that are going with it, the sentiments of maybe guilt, of frustration, A lot of people feel that they lose their independence once they move out of their home into a senior living facility. So there is a wide variety of emotions and feelings and thoughts that go along with that process. Although what I can tell you is that by far most of the people who actually move into a senior living place, the right one, of course, the right place, pretty much all of them say the same thing. If I knew that I was going to have this type of life here, I would have done it many, many years ago. Because really, it is an improvement in many aspects, and we can talk about that as well if you want. But going back to the emotions and the thoughts and the feelings, yes, it is a difficult time. The moving in itself into a senior living place, that is emotional, adjusting at that new place. It comes with a variety of feelings in all parties involved. Uh, but the more time goes by, the better and better things are getting, and the resident gets to know the staffing there, starting to see the benefits of being there. Uh, in many cases, the nutrition is better because now they have a chef cooking for them 3 meals a day, and the variety of meals, things that many of them did not have at their house, especially in the last few years. Um, and the social activities, the friendship that they initiate and they develop in that environment, the love and the care that they receive from the staff working there, the uh, accessibility of through their activity programs to go in a group with a van or the facility bus to a symphony, uh, to see the flowers in a field, to go to the mountains and touch the snow. So there are a lot of benefits, but a lot of people they're not aware of all those benefits until they actually move into that facility and they experience it, they live it themselves. But ultimately, going again back to the emotional and the thoughts and the feeling,
Yeah.
in time, the routine um kicks in, and then everybody knows what the role is, and the new home becomes a home, a real home, and then everything is going well, progresses well. Yeah. Now, when it gets to that point where the condition, the health condition, the functionality condition of the resident changes, let's say declines, then of course, the family members are involved and the facility and the resident, and it depends how much decline is going to happen, how far that is going to go.
Yeah. And then, like, many families, like, quietly wonder if questioning, like, assisted living means they failed their parent. How common is that feeling?
I don't know if I can call it is a common situation. I think it always starts with the very beginning when people are looking, touring, visiting facilities, if they make the right choice or not. Um, the a lot of people they do a Google search, they end up looking at very well put together, glossy looking websites, and everything looks amazing. And then they set up an appointment, and then they meet with a well-trained salesperson at those facilities, and they hear everything they want to hear, and aesthetically it looks beautiful, and they say, okay, we found the right place, and then we're going to move mom into this place. And 6 months, a year, 2 years, 3 years down the road, health changes happen, condition changes, and um, it turns out that it's not the right facility for a variety of reasons,
Yeah.
so yeah.
And at that time period, like those kind of feelings like come, okay, maybe we at that time we didn't notice that things, we didn't notice like facilities licensed or not, or they care the extra level of care they are like looking for now. So that kind of emotions sometimes like people burn, and sometimes people feel guilt, sometimes people like afraid like what will happen in the next facility or when they move in the next like level of options. So
Yeah.
I will say like if any of these feelings familiar or who are listening this podcast, you're not alone. In the next episode, we will talk about what families can do when they reach at this point. Thank you, TP, for your time. And I will say, like, if people are in currently in that situation, and if they wanted to reach you out, how they can connect with you, and how they look like with you if they are communicate with you.
Sure. But before I give you all that important information, I want to mention that a pretty high percentage of the families that I help and I work with, they already placed their mom or dad or a loved one into a facility some time ago. It could be 6 months, a year, 2 years. But now they got to a point where the facility is not appropriate any longer. They find me, and now they don't have to handle all that by themselves. Now they're talking with an expert in senior living and senior care, and I can definitely direct them towards the right choices. How the people can find me? My website, a1seniorcareadvisors.com. Feel free to visit my website. You find all my personal contact information there through email or a phone number. The site was built for educational purposes, so there is plenty of information, blogs, and a lot more that you can find on that website. But a1seniorcareadvisors.com.
Thank you, and see you in the next episode.
Okay, very good.
Yeah.
Thank you. Goodbye.